Hello, so let's talk about medical complications during pregnancy. So, one is preeclampsia. So, preeclampsia, this is a persistent high blood pressure during pregnancy, and it can also happen during postpartum period. But right now, let us focus on a pregnancy. So one of the classic sign, and I want you to really take note of it, is the high levels of protein in the urine. In other words, the woman will be losing the protein in the blood vessels. Now, what is the major role of this protein? A very specific protein, which is your albumin. The albumin is supposed to be like a magnet that keeps fluids inside in the proper places inside the blood vessels. Okay, the fluids inside the blood vessels. So when there are no albumin or there is less albumin in the blood vessels, that means there's less magnet keeping the fluids inside the blood vessel. So, what is the effect? There is the tendency of these fluids to shift out from the blood vessel. Okay, where will it go? It will go to interstitial spaces. It will go to the extracellular area, and that is where the fluids will stay because. Again, there is no albumin to keep it inside the blood vessel. Why is there no albumin? Because the albumin or the protein are lost in the urine. In other words, the kidneys are excreting it. Why is the kidney excreting it? Because of the high blood pressure. Okay? It's the effect of this high blood pressure brought about by hormonal changes in a woman during pregnancy. Not all women experience this, but there are women which or who experience high blood pressure during pregnancy. It is the state of pregnancy that is causing the high blood pressure. And the effect is again, kidneys will expel out the protein. So you see a lot of protein in the urine. You call that proteinuria or albuminuria. And the effect is the albumin or the protein is not anymore they're in minimal amount inside the blood vessels, and so it cannot keep the blood volume inside the fluid inside uh, the blood vessel compartment. There is a fluid shift. Now, why is that so relevant? Because the fluid shift, if it happens in the brain area, okay, there will be swelling inside the brain, and that swelling can lead to seizure. That's why women who are preeclamptic, you watch them for seizure. Okay, they will have visual disturbances, and if they have seizure, they lose oxygen in the process. Okay, they can fall, and that puts them at risk. Now, the fluid shift can also happen in the lungs, so there would be difficulty breathing. Okay, so this is not your regular hypertension. This is hypertension with proteinuria. Okay, and which is causing all this fluid shifting. So, as you can see in the slide, the pressure is high, and that's the initial effect of the hormonal changes in pregnancy of this woman. The fluid shift can cause sudden weight gain because the woman is retaining fluids in the wrong places. The face go round, there's swelling on the legs. It's pitting edema because it's the fluid that are retained are also being are going down into the legs because of gravitational pull. And when you check the urine, it is positive for protein. Okay, so we call that preeclampsia. So to decrease the high blood pressure, okay, we want to clear the circulation. Now, think about your cardio anatomy. The vena cava is in the right side of the body. So we want to make sure there is good return of the fluids from the bottom of our legs to the other parts of the body. We make sure there's a good return to the heart. And so we want to free the vena cava. The vena cava is in the right side of the body. And so the classic NCLEX question would be, how do we position our pregnant moms suffering with preeclampsia? So we have the mom turn to her side, but very specific, on her left side. Why left? You want to make sure the right side is relieved from any attention. So we put the right side up, and that's why we lie on the left side. This is to favor blood flow, decrease the risk of preeclampsia. And if the woman has preeclampsia, there's fluid shifting, there is problem with the lungs, there is possible seizure, there is less oxygen supply to the fetus, okay? Because as I explained, if there is high blood pressure, there is also a decline in the blood flow. So decline in blood flow means less nutrients, less oxygen going to the fetus, okay? Less blood supply to the uterus itself. So that can lead to stillbirth, okay, or death of the fetus. Now look at the woman here on the right side. There's a big X. Don't let the woman lie flat. Why? The big gravid uterus is gonna compress down on the weight is gonna go and press onto the vessels of the woman, which actually can worsen the already increasing pressure. Okay, we want to make sure there's nothing that constrict the blood flow. That's why lying flat is not good. And at the same time, remember the lungs are already congested with the fluid shift. So this position also does not favor the uh, breathing because the lungs are like uh, pressed down. Okay, so correct position is side lying, left side lying. Okay. Now, we also have a term called eclampsia. So, there's a pre-eclampsia and an eclampsia. So, between the two, the severe one is really the eclampsia. So, let's look at the difference. Okay. In pre-eclampsia, there is high BP, there is proteinuria, but then we know that when proteinuria is so severe that there's already severe shifting of fluids, and it's already affecting the brain, and thereby there is already seizure going on. When that condition happens, we already are in the worst phase, which is your eclampsia. Okay, so preeclampsia is characterized by high blood pressure and signs of organ damage, usually in the second trimester already of pregnancy. So blood pressure can be as high as 140 over 90 or even higher. And classic sign is proteinuria. Okay, there is swelling, there's headache because of this high pressure, visual changes. So that's already a bad sign. That means the swelling has gone to the brain. Okay, so preeclampsia means pressure problems. Okay, when the woman goes to eclampsia or severe preeclampsia, that's your eclampsia, brain is highly affected, so there is seizure already. Okay, with seizure, there is loss of consciousness. This is already emergency situation, okay? Because seizure means lack of oxygenation can lead to stillbirth of our fetus. Okay. So in preeclampsia, one can have headache. That's already a bad sign. It's gonna proceed next to the seizure, which is your eclampsia. There's blurring of vision, swelling of the body with all the fluid shift, epigastric pain. That means this you're referring now to the uterus. Okay, so the high blood pressure reduces. When we say blood flow, we're not actually referring to an actual blood. So take note of that. Blood of the mom does not go to the fetus. So I would understand the confusion because of the way words are said, blood flow, but it's not the blood glow going to the fetus, but the nutrients and the oxygen. And in the severe phase, that's already with seizure. Okay, so the breathing goes slow. Okay, because this is a case already of there is uh fluid shifting in the lungs. Okay, um, there is toxicity when there is no more reflexes. Okay, now I want you to remember the treatment. Okay, treatment is magnesium sulfate. Okay, magnesium sulfate, what does it do? It relaxes the uterus. Okay, it relaxes the uterus. It also uh, reverses the hypertension. Okay. Now, antidote, when you say antidote, when there is also toxicity, when mag sulfate is already in extreme, because you only need a small amount of magnesium in the body, but without it, um, it can, or when also in excessive, it has also a very bad effect, this mag sulfate. So take note when you give mag sulfate, be ready with the antidote, which is your calcium gluconate. Okay, calcium gluconate. Now let's go to another medical condition, which is gestational diabetes. Okay, so when we say gestational diabetes, okay, the cause of it is for some reason because of pregnancy hormones, the body of the woman become insulin resistance. Okay, insulin resistance. So because of that, okay, the insulin resistance, um, the mom who's taking in the usual food, carbohydrates, okay. So because the insulin, because the pancreas of the mom become insulin resistant, the mom will not be able to absorb much the glucose. Okay, so where will the glucose that she is not absorbing well? There is metabolism issues. So the sugar that the mom is taking and it's in the bloodstream, so where will it go? It will now go to the fetus. Okay, it doesn't go to the mom, it goes to the fetus. So what is the effect? The fetus receiving all those sugar can grow large. So you have a large baby, which is what we call macrosomia. Okay, macrosomia. The glucose just goes straight to the fetus and the fetus utilizes it. Now take note, why is this low blood sugar in newborn? Okay, take note, the fetus when inside the mom's womb takes all the sugar, okay? But then when the baby is born, okay, there will be a drop in her sugar level. Why? Because the supply was from the mom. And so when the baby is now taken out from the mom, naturally there will be a low blood sugar. It will start dropping because see, the thing is, okay, let me explain further. When the woman the sugar of the woman is not being utilized much by the woman because, again, the woman has insulin problem due to the pregnancy hormones. So all the sugar now goes to the fetus. Okay. The fetus receiving all this sugar, the pancreas of the fetus gets hyperactive to metabolize all this sugar, correct? Now, when the fetus is delivered, what is cut off? What is cut off is the sugar supply from the mom. But the fetus routinely already produces insulin, his own insulin, to absorb the sugar. Okay, but there's no more sugar to absorb, so there is a tendency that the fetus still produces that high insulin, but there's no more sugar to absorb. That's why upon birth, there would be a sudden drop in the blood sugar, which is also dangerous for the fetus. So, in other words, when you have a mom with gestational diabetes, you gotta monitor how much the mom is taking carbohydrates because all of that will go to the baby and the baby can become macrosomic or large. And another thing that we gotta monitor is when the baby is delivered, because when the baby is delivered, body's reaction of the fetus is uh, there's no more sugar supply, but the pancreas continues to produce large amount of insulin because it is used to it inside when the fetus is inside the womb. And so there could be a sudden drop in blood sugar, hypoglycemic effect. Okay, so that's why we gotta make sure the mom is properly managed, control her diet, monitor her sugar, and we may need to give mom insulin so that the sugar that she has, she can really utilize it and not go to the fetus. Okay, so you see here 5 ways to stay healthy with gestational diabetes. Create a healthy carb strategy such as swapping out refined carbohydrates such as white bread, candy, and soda for fiber-filled alternatives like whole grain bread, fruits, vegetables. Okay? Now, keep blood sugar steady by spreading carb intake throughout the day. In other words, small, frequent meals. Okay? Instead of taking large amounts one sitting, opt for small meals, low carb snacks every 2 to 4 hours instead of having 3 large meals per day. Pregnant woman should stay active, utilize that glucose, okay? Even a short 10-minute walk every meal can make a huge impact. And pregnant woman, monitor your blood sugar, okay? Uh, so you know that whenever your sugar spikes, those sugar goes to the fetus, okay? And have a consultation with your doctor. Women with gestational diabetes have higher chances of developing type 2 diabetes later in life. Okay, so that would be the effect of gestational diabetes. Again, remember it is caused by pregnancy hormone. The whole insulin in the woman is not working effectively. It's caused by the pregnancy hormone. So usually after delivery, the woman returns to her normal self. Okay. But there's a risk of type 2 diabetes for mother later in life. Okay. So you see here in the bottom, the high blood glucose level in the mom will bring that extra glucose to the baby, leading to macrosomia or large babies putting on weight while still inside the fetus. Then we have anemia. So as I said earlier, there is an increase in the amount of blood volume in pregnancy, but just the volume, okay? But the cell itself, especially red blood cells, are hyperdiluted, or there is a drop in terms of uh, cell volume comparatives. Okay, so a drop in red blood cell also means a drop in hemoglobin. Okay, and you know that that is important because that is where the oxygen will ride on and bring it to the fetus. Okay, so when there's anemia in pregnancy, the fetus also kind of oxygen deprived. Okay, and then aside from your typical H and H, also note that the woman needs to also improve the RBC by not just taking iron, but other vitamins that are necessary for a healthy red blood cell. And what are these? Your folic acid or folate and your vitamin B12. Okay. So that folate is actually important because a good it makes the blood of the woman super healthy, and also uh, the folic acid is able to cross the placenta and go to the fetus, also improving the uh, it is linked to the development of the fetus, especially in the development of the spinal cord of the fetus. Okay? Vitamin B12 is for the nerves and also help in the RBC formation. So the intake of B12 helps the mom, and these vitamins also go to the fetus and help the fetus in terms of formation of their red blood cells and the rest of the organs of the fetus. Okay? So again, those three uh, vitamins and mineral, iron, folic acid, and B12, they all contribute to the formation of a healthy red blood cell. Healthy red blood cell. And so it is very, these are important nutrients to fight the anemia that usually happens in pregnancy. Okay, so you have your symptoms here. If a woman is anemic, anemic, hold on, guys. Anemic means um the red blood cell is down. Okay, anemia, red blood cell is down. When red blood cell is down, there is less oxygen, there is less nutrients to carry because we have less red blood cell, which is the carrier of those nutrients and oxygen to the fetus. So both the mom and the fetus, when there's anemia, is weak, and especially the mom is characterized by pale skin, shortness of breath, dizziness, lightheadedness, cold hands and feet because there's lack of oxygen, and increased heart rate. Okay. Risk factors for this anemia would be poor diet, of course, multiple pregnancy, and chronic illness. Okay. By the way, we teach the mom to take iron with vitamin C and avoid milk if we're taking iron because milk actually blocks absorption of the iron. Iron is best absorbed with acids. Okay, milk is base, so it actually hinders the absorption. So acid, so one would be ascorbic acid or vitamin C. Okay. Now, other things, other medical condition that can affect the woman is cardiac disease. Now, remember, in pregnancy, there is increase, by nature, there's increase in cardiac volume. Okay. So pregnancy increases the heart workload. The heart has to beat faster. There's by nature increase in volume. And so the heart can easily get tired of the heart of the mom. So we advise the mom to always have rest periods, okay? And assume semi-Fowler's position. Semi-Fowler favors chest expansion, so breathing is better, okay? And we monitor the mom for shortness of breath, okay? Because when the heart is having trouble, contracting and doing the workload, it can actually cause backlog in circulation, okay? If the heart is not pumping well. So the heart is not pushing blood to circulate, there's some backlog, okay, in the flow. And this backlog can actually cause fluid accumulation in the lungs. So when fluid accumulates in the lung, there would be shortness of breath. If circulation is not flowing well because the heart is having problem pushing fluid around, some of the fluid can stay in the lower portion of the body. So there would be swelling on the feet and the legs. Okay. And then if the woman stands up, okay, since there's a poor circulation, most of the fluid or blood volume will tend to drop down. So you could lose, the woman could have a sudden loss of blood volume in the brain. So that can lead to dizziness and weakness. So we advise moms with who are pregnant to, when they're changing position, they have to do it by face. They don't just stand up. From lying down, they gotta sit well, dangle their legs, allow the body to catch up with circulation. Okay. And then the heart can go racing. The mom feel like my heart is beating too fast, but it's an inefficient beat. It doesn't really cause circulation. It's like a weak heartbeat. Okay. And since there's the heart is already doing a lot of workload because of increased blood volume, and if there's also innate cardiac disease, the mom can easily get tired, brought about by this by the cardiac issue itself, and you add the pregnancy. Okay, uh, there is less blood getting into the organs and muscles because of the poor circulation. So, with less blood supply to the cells and muscles, there's less oxygen, less nutrients, so less energy in the cell. Okay, so rest time is necessary. Sudden changes in position should not be done. There should be pacing of self. So this is a central illustration, universal cardiovascular disease risk assessment in pregnancy. So the goal here is to integrate cardiovascular disease risk assessment into a routine obstetric care so we can identify who are at risk for cardiovascular disease. So one of the recommended diagnostic tests is EKG or your ECG. And if you want to really look at the structure of the heart of the mom, if there are issues, it would be an echocardiogram, a 2D echo, which look at the shape of the heart, the muscles, the strength of the heart. We also have blood tests, which check the BNP, okay, check the heart in term, because when the heart is functioning well, it will produce certain chemicals. When it has some problems, it will also release certain chemicals. So this is more of an ICU nurse now doing this issue here. But this is a very detailed assessment now on the client if she's got some cardiac issues. So those tests will allow us to monitor high risk patients throughout their pregnancy. Okay. So when we look at when we do a physical exam on the map, So remember, lungs and the heart are equally are like related. So we also listen to the lungs, because if the heart is not pumping well, what did I say? The circulation is also sluggish. There's some delays, so some of it can be pooling in the lungs, so you can hear crackles, fluids, okay? Basilar fluids, or in the base of the lungs. So that's your crackles. And then your heart, if there are some valves that opening and closing at the same time, you hear murmurs. Okay? Uh, the rate of we make sure vital signs are stable, okay, and we ask if these symptoms are, the woman would be saying she has shortness of breath, she has a sudden drop in blood pressure when she stands up. Um, Other conditions would be if she has asthma, okay, and then you have your palpitation, which is the sudden heartbeat, dizziness, especially in standing up. And the worst would be when there's chest pain. So that could be a sign of a myocardial infarction. So who are at risk with cardiac issues in pregnancy? Aging woman, age 40 above, okay. Woman with pre-existing conditions such as diabetes, hypertension, woman taking certain substances such as nicotine, cocaine, alcohol, methamphetamines, and also women with chemotherapy, because these are also very strong medications entering the human body. So, in closing, it's not easy to be pregnant. Okay, uh, we only talk about medical conditions, and that's already a lot of issues involved there. Pregnancy is going to alter your thinking forever. It's going to make you realize how fragile and important life is in the life of the mom, the life of the growing fetus. And that's why, as a nurse, it is most important that we teach our moms, the family members surrounding the mom. We have a big role being nurse, caregiver, our as client advocate, that we are a big part on during pregnancy, why we really have to pay attention, because we have to protect our moms, our babies, and the total well-being of the family. We would understand now why it must be protected at all costs. Okay, so uh, welcome to OB nursing. Now that we're starting to really understand our role as OB nurse, we are one of the reasons and the solution in having a safe pregnancy for our moms and our babies. Okay, that ends our lecture. Thank you for listening.